My name is Sylvia Mckoy, and I live in Elizabethtown, North Carolina. I was sick a lot, and I did continuously go to the emergency room. And from there, they sent me different places, but at the time, I didn't have a primary doctor, so I was like thrown from here to there. I wasn't getting any answers, And when it comes to your health, you really want to know what's going on with your body. And when you don't have one person tell you this, and then you go to another doctor and they tell you that, then you still right back where you started.
Ms. Mckoy is an individual with multiple healthcare problems that had bounced around the healthcare system. And for us here in rural Eastern North Carolina, that often meant the emergency room, the hospital, and other places in an effort to try to get her needs taken care of. She needed someone to take the time to actually sit down and go over her healthcare needs and how to take care of her healthcare needs. She needed guidance. She needed someone to instruct her and guide her through the system. And we've gotten to see that she does have needs for some additional resources that I can't necessarily provide for as a primary care physician. I had access to a nurse care manager who was able to help from the standpoint of nursing, and we had a period where we actually had access to an embedded pharmacist actually in the practice who could help subsequently at that point with her medication needs and teaching about her medication.
As a care manager, we work with patients that are coming directly out of the hospital normally, or either we'll get primary care referrals from Dr. Rich or other providers at Blade Medical, and we'll see them in the home, in the hospital, or here at the practice. They don't really understand the needs to adhere to the medications or the doctor's plan of care. They don't really understand their disease process. So it's important to go in and try to educate the patients and get them on board so that they'll be proactive in managing their health.
The system as a whole is so overwhelming to folks. They're trying to deal with just their personal conditions that they've been diagnosed with, much less everything else that's part of this healthcare puzzle, and it can be very overwhelming. And to have that team-based approach, and they know they've got their physician, they know they've got their pharmacist, they know that they've got their nurse or care manager that they can call upon, regardless of the question, and it all comes back home to them. And it makes sense.
With Miss Mckoy, she would utilize the emergency room when she started feeling symptomatic, being short of breath, having the weight gain, not being able to sleep because she was so short of breath. Now she knows to get in touch with the primary care doctor, and if the primary care doctor is not available or if it's after hours, she knows to go to our express care, which is linked with this facility, Blade Medical, and it's less cost going to the emergency room, utilizing her primary care physician, her medical home, so to speak.
The lowering of utilization of the ED particularly, that's one of the things that we really focus upon. And the transitions, if she does get into the hospital, that we make sure that we have somebody in contact with her, preferably within 72 hours of discharge. So if she's got a list of medications that she went in on, and she's got a list that she left the hospital with, and they don't match up, then we're all working together to make sure she knows exactly what she needs to be taking at the time. And so there's not duplication of therapy, there's not, again, adverse effects or drug interactions. It's just that focused care approach that we're able to provide for them. And we have seen those numbers decline. Yes, for Ms. Mckoy, but it goes well beyond Ms. Mckoy. And so when you multiply that by many patients, you're going to get cost savings.
Yes, it is true. There are some costs up front in terms of having a nurse care manager, having a pharmacist here. But think about what you've done. If you prevented one hospitalization, if you prevented one emergency room visit, you've paid for those services.
I haven't had to go to the hospital quite nearly as much, because most of the time if something go wrong, 9 times out of 10 I can come in to see him, and this way it keeps me from the emergency room and so many other doctors.